Welcome to the video of the impact of new technologies and digitalization on society about the COVID-19 outbreak. In this video, we are coming through what is COVID-19, the impact of new technologies on helping to deal with the virus, and lastly, were these technologies successful?
The coronavirus, otherwise known as COVID-19, is an ongoing worldwide pandemic that has affected more than 25 million people and counting. This moderately infectious disease exhibits symptoms similar to the common cold, that is usually spread from being in proximity of an infected person. Many restrictions have been placed upon the populace to ensure their safety and have been enforced strictly. Those who have shown symptoms of COVID-19 have been asked to be tested for positivity and to self-isolate themselves for a minimum of 14 days. Otherwise, a distance of 1.5 meters should be maintained between individuals to reduce the chances of spreading the virus. Many precautions have been taken to reduce the amount of contact time between individuals by introducing an element of software to communicate. Applications have been created to inform the populace of COVID-19 updates and to continually remind their safety when they are outside.
QR codes in COVID-19 outbreak. QR codes represent a piece of barcode drawn by white and black pixels that are readable by smartphone cameras. By hovering a smart device over one of these QR codes, both parties are able to collect information about the other. The usage of QR codes has bloomed at the peak of the pandemic as to reduce the periods of contact between individuals, yet still effectively communicate between each other. Advanced by New South Wales government that QR codes must be set up in public places, including business, to prevent COVID-19 spread in community. QR codes link to a website or forums where customers fill in their identity and contact information. Many retail stores and restaurants have been instructed to keep an active record of their customers that use their services, otherwise known as contact tracing through QR codes. These efforts are provided to help contain those that have been potentially affected by the virus, hence reducing the possibility of spreading COVID-19 to the populace.
Decision support systems utilizing artificial intelligence or AI has the potential to allow for efficient screening and accurate diagnosis, whilst also improving management and treatment of the disease. Based on a patient's clinical history data, vital signs data, and the medical scan data, an intelligent decision support system trained with other patient clinical data can decide the level of treatment required, forecast potential outcomes, and tailor plans to individuals. The system can also output triage information for doctors to determine an individual's urgency for treatment, potentially saving lives of critically ill patients. A patient health monitoring system utilizing AI and machine learning would reduce the workload of doctors whilst also increasing hospital space. To free up hospital beds, COVID patients with milder symptoms are sent home to quarantine with wearable monitoring devices. Data is continuously collected and sent to a virtual care centre for analysis. If the AI system detects the patient's condition is getting worse, the hospital is notified and the patient must return to the hospital for physical monitoring and further treatment. Due to the mass volume of patients, doctors and nurses are overworked, decreasing the quality of care for all patients. With an AI system helping monitor patients, high quality of care can be delivered to patients in need.
Many office workers have been advised to work from home to practice social distancing and perform tasks through video conferencing technology. This involves several mobile devices which are connected to a designated server, which then displays live video and audio. This technology carries many advantages such as the ease of use, convenience, and compliance of social distancing regulations. To conclude, many different forms of technology have been developed and improved to cater to the different needs in the world with the current pandemic. These technologies assist in containing active cases, enhancing medical support, and reduce possibilities of direct human contact. As shown by researchers, the number of active cases of COVID-19 in Australia has steadily declined. Hence, the mentioned technologies have successfully reduced the transmission of the coronavirus and are continuously improving to ensure that society is safe as can be.